Good day and welcome to the review of Chapter 13, Workplace Safety by Charles Fleischer. Much of this information is review because some of this has already been covered in previous chapters. This chapter begins with a review of the Occupational Safety and Health Act, which was passed in 1970, and it resulted in the Occupational Safety and Health Administration, OSHA, being formed. Employers are required to comply with all applicable OSHA standards, such as the list found in our text. Some of these standards include keeping work areas clean, orderly, and sanitary, keeping floors clean and dry, and having emergency action plan procedures. These are just a few of the OSHA standards. Although OSHA does not require companies to have defibrillators at the worksite, many states do require such, along with having trained personnel in the use of the AED devices. Please review the section in our text called Hazardous Materials. OSHA has created detailed requirements for hazardous materials such as handling and storage and exposure controls and personal protection. Please also read over the sections called Lockout, Tagout Standards and Nanomaterials. OSHA has many standards for personal protective equipment, or PPE. The standards are there to protect workers' eyes, faces, heads, extremities, respiratory systems, and bodies. So, if OSHA requires certain employees to use PPE while they're at work, whose responsibility is it to pay for the items? Well, in most cases, the employer is required to provide PPE. There are a few exceptions, such as if the employee loses or damages their PPE. Bloodborne pathogens are infectious microorganisms found in human blood and other bodily fluids, and they can cause disease in humans. To reduce or eliminate exposure to bloodborne pathogens, employers must have exposure control plans. The employer must also follow universal precautions, which means blood and bodily fluids are treated as if they are infectious. OSHA ergonomics guidelines have been created to avoid MSDs. Some risk factors include heavy lifting, bending, reaching overhead, and pushing and pulling heavy items. OSHA published mandatory ergonomic standards. The list of occupations included in the guidelines are listed in our text. Also in our text is a list of required record-keeping results for any employer with 10 or more employees. Remember, OSHA inspectors are authorized to enter and inspect any workplace to ensure compliance. If violations are found, the organization may receive a citation or a notice of violation. Penalties can also be imposed, which can cost the company a lot of money. The Federal Food and Drug Administration, or FDA, oversees the food industry, along with state and local agencies. Under the Occupational Safety and Health Act, employees cannot be retaliated against if they file an OSHA complaint or they exercise any right under the Act. Also, the NLRA protects workers who voice safety concerns or engage in job action to protect safety conditions. States can assume responsibility for OSHA matters if the state develops a plan that is at least as effective as OSHA itself. We have already talked about workplace violence in previous chapters. Please review the list found in our text that employers can do to prevent workplace violence, including the section on guns in the workplace and disaster planning. Our chapter ends with a list of things that employers can do in the event of a pandemic, such as encouraging frequent hand washing and spreading employees over work areas while allowing staggered work shifts. This concludes the review of the Workplace Safety chapter. Have a wonderful day.